When we look at a model of the male reproductive system, it may look confusing. What the heck is that? Well, I think we know what that part is. But sometimes a simple sketch will help us to really understand and separate the different parts. Right now I'm drawing the urinary bladder, which is situated sort of in the center of view. And it's going to have a long urethra coming down. So the urine forms in the kidneys, of course, and it's going to go down the ureters. And here in the model, you see it sort of disappears. Okay, the urethra carrying urine, it doesn't disappear in the real body, but in the model, it comes back down and reappears coming down through the penis. Now this channel carries other ingredients that I'll talk about in a little bit. Surrounding the urethra down at the bottom end is the glans penis here at the tip, which the foreskin, there's a lot of debate. You know, should the foreskin be removed? Should it be left on? And there's some evidence that if the foreskin is not removed, then there's an increased incidence of cancer and maybe infection, but that's individual. Some people don't seem to have that problem. Okay, within the penis itself are these erectile tissue compartments, and there's many of them in different shapes as well. And so this is where blood flow comes into play. Now sometimes we see movies, you know, sexual activity, everyone's excited, but in reality, for a man to experience erection often requires the nervous system to be rather calm. If we have flight or fight going on in the nervous system, then blood flow is going to stop. So the man needs to be fairly relaxed. Well, I mean, he could be interested, but not worried and scared. That's the wrong way to be. So that's the erectile tissue. Sorry, it took me a while to draw those. And moving on. So we have the prostate, which is a big player there, and then we have the seminal vesicle. You don't hear much about the seminal vesicle, but it has an important role in nourishing sperm. There it is coming off and emptying into the urethra here. Let's do that prostate, because for many men, the prostate is a structure that's going to swell as they age, because testosterone in the bloodstream is going to attach to receptor sites on the surface of this prostate, and so we have something called hyperplasia. It's going to swell, and so as a man ages, this urethra is going to be pinched off, and urination becomes a little more difficult, and you have to get up several times at night, often to expel urine. It's just one of those things of aging. Okay, we have the rectum, which is really not part of the reproductive system, but it's back here, coming down. You can see it on the model. And here's the colon way up top, so the colon's going to wrap around and also share some of this space. So if we get some labels here, it makes sense out of all this. We have the two types of erectile tissue. Spongiosum is on the bottom. Cavernosum is on the top. Oh, sorry about that, on the top. Urethra coming through here. Glans penis is the head of the penis there. Testes I haven't talked about, and that's a major player in this whole story. So let's get on to the testes. But before we do that, at the top of the testes is a structure called the epididymis. And it's not really straight like that, like I've drawn it. It comes around, curves, comes up, and then there's a tube called the vas deferens, which in the model, coming back to the model, you see it's been cut off, and that's typical for these models, to cut off the vas deferens. Here's the testes, and that's where spermatogonia are going to mature into spermatids and form a sperm. Erectile tissue I talked about. Prostate all the way down here. Seminal vesicle nourishes the sperm. Rectum back in here. Prostate over here. Vas deferens is the tube that leads out of the epididymis. Epididymis is where the sperm is going to mature. So this is an area where if a man does have ejaculation, sometimes he can have one a little while later because some of the sperm is stored in the epididymis, because the sperm is formed in testes, but this is kind of a storage spot where they're on deck. They're ready to play. I hope this makes sense. When you look at this, okay, urinary bladder, urethra, there's the prostate, seminal vesicle, rectum back here, on to the two types, cavernosum here, spongiosum down below, urethra, glans penis, testes, epididymis, emptying into the vas deferens, coming around and feeding into this region.